Wow, what a story.
People have to go to the bathroom, and if you don't give them an option, it's going to end up somewhere. Who's going to pay for this?
What if finding a public bathroom wasn't just inconvenient, but nearly impossible? For Fletcher Wilson, it started out as his own frustration, which he soon realized was a universal need that no one seemed to be solving. His search for a solution led Fletcher on a journey that's included conversations with Uber drivers, dealing with waste in every sense of the word, and even saving actual lives along the way. Now, with Throne Labs, Fletcher's rethinking what dignity, design, and public space can mean when you bring humanity back into the equation, and how bathrooms just might be as medtech as it gets. Fletcher, thank you. Thank you so much for talking with me on the podcast today.
Really excited to be here. Thanks for inviting me.
Yeah. So I was thinking maybe we could dive right in and talk a little bit about, or talk a lot about what you're doing with Throne, but maybe dive in and hear about the real world experience of the unmet need and what that looks like.
Sure. So I guess the story starts back in sort of COVID days. I was living in San Francisco and, going about my life. And I'm someone who struggles personally with various GI related disorders, nothing clinical, but let's just say, I always say my GI system is my worst system. So I, found myself in many situations sort of, let's just say, frustrated with existing bathroom infrastructure. And when I say bathroom infrastructure, kind of mean that broadly, public bathrooms, but also availability of bathrooms in retail locations, anywhere as you're kind of out and about in public, how an everyday person might use a bathroom. And so I just got kind of thinking on that problem. And, as we do in biodesign, especially if you're maybe a physician, that would be probably the corollary where you're used to dealing with your own problem. You then need to go out and kind of validate that this is a real problem and what the need really looks like. And I think what I did, and a lot of this came from biodesign training, is started kind of interviewing people and understanding the breadth and the specifics of the need. That entailed talking to folks who, let's say, drive for a living, Uber drivers, Lyft drivers, Amazon drivers, mailmen and women, police officers, etc., and found a very specific set of needs that I would identify as infrastructure issues. Talked to, I would say, various people interfacing with the homeless community, folks suffering from homelessness and different community organizations. And then also kind of on the other side, folks kind of more in government or around government, frustrated with, let's say, cleanliness of streets related to biohazard waste and whatnot. That was a big thing in San Francisco. And kind of realized, okay, there's another pocket of needs having to do with properly serving folks that don't have reliable access to bathrooms. And then there's sort of your athletes, or recreationalists. There's your folks, businesses that are maybe annoyed with the obligation to provide bathrooms for the public, maybe even when they're not buying something from their retail store or kind of coffee shop. And so all this together, I would say, was sort of one side, kind of the user-based side. And then over time, I'll get into this, but I think there was sort of a government-facing issue with how hard it is to provide bathrooms. And I think the sort of problem we came to was it's difficult to provide bathrooms to the public even if you want to. And so a better way, and I can get into better because there's a lot of little facets here, but a better way to provide nice bathrooms that people actually want to use for the public was sort of the starting point. And then from there's a million kind of pathways we looked into in terms of how to better define that need and kind of inform a potential solution.
Wow, that sounds like just a real big problem with a whole bunch of different considerations that kind of factor into it. I'd love if you could share any story or stories that maybe struck you as you were starting to speak to people and try to understand their experience.
The quintessential story, I mean, I would get into a car with an Uber or Lyft driver and just ask, where do you go to the bathroom? Do you mind me asking, where do you go to the bathroom when you're working? And that's the type of thing we learned in biodesign, right? You have to just be willing to ask the tough questions to a patient, to a doctor, et cetera. And that training really paid off here. And like I used to find in biodesign, like people want to talk about their problems. And so I think the fact that I almost always got an answer, I think was telling by itself. Folks were happy that someone was actually considering this kind of private and weird problem. But I got all these different types of answers, having to do with strategic driving around the city and trying to get, positioned next to this one bathroom at some point in their day, laying off coffee and water throughout the day. But I think the story that I often tell is I was driving in San Francisco, asked that question, guy pulls over and says, "You really want to know?" And opens up, starts reaching for his glove box and starts opening it up. And I was like, what's going to be in here? And he pulls out a rolled up necktie. And sort of his solution for the bathroom problem was to throw on a necktie when dropping someone off at a hotel so that he could go in and seem like a patron in a hotel. And I that always struck me as, wow, what a big problem this person feels the need to put on a costume just to use a bathroom while working, their office bathroom, so to speak. And so I think the original through line was potentially, let's develop the office bathroom for the mobile worker. Over time, we found that the business solution for that wasn't ideal, but is still a useful kind of, let's say, subcomponent of the need.
That's really interesting, the mobile worker component about it.
Yeah.
So it's interesting that you mentioned one of those early iterations of your target customer, I guess, or who you were first thinking of building for was the mobile worker, because that really pulls into the conversation a very specific person with a very specific set of experiences. And it sounds like you maybe broadened a little bit from there as you started building. What was the next step from there? Did it stay the mobile worker, or was there a second type of person that you were imagining as you continued to start building this?
Well, first, if I could speak to why the mobile worker didn't end up making sense as a primary kind of end user. And I think, again, I'm going to try to bring parallels into the medtech world as possible, but I think this is a situation where the user case, the sort of equivalent of the patient need, was totally there. The issue is the payer. Who's going to pay for this? And kind of imagine we went down this path and realized there isn't a payer here. There won't be reimbursement. And so the issue being, we would talk to the Ubers and the Lyfts and the Amazons of the world, and it's not that they weren't interested in providing better bathrooms for their drivers, but there were some really interesting kind of legal and let's say HR labor compliance issues when you're dealing with a 1099 workforce, and it got really complicated, and the incentives weren't well aligned to allow a big organization to pay for a distributed bathroom network for their drivers. And certainly the idea of like charging Uber drivers to use the bathroom felt icky. And so again, so we kind of, and this happened a lot, we kind of got to the point where we have to separate user and customer. And the business model will make most sense if we can deliver the best possible service to the user and leverage them as sort of a voice to a different payer. And it's actually kind of hitting me now. There are so many parallels with medtech where the payer and the user, payer and the patient are different. And maybe that kind of served me well in kind of developing this. But to answer your original question, where did we kind of go from there? We went on a brief adventure looking at user pay and kind of the pay out of pocket type of deal. The founding team never felt good about that, but we did pricing studies. We dabbled with sort of a bathroom credit solution, and just in America, I think there's this really interesting belief and kind of cultural feeling that bathrooms, are should be provided to me as a right, and that just is something you don't want to try to fight against or change people's mind on. And so this feeling that maybe there are situations at a concert or in very specific situations where people would be happy to pay, but that's just going to be a hard sell over time. And so it really became clear as we really did this deep analysis of all the different use cases and needs that sort of the municipal sector was the target, and that this could serve as a public amenity seen to be politically popular in various locations and situations to provide an easy way for cities to provide nice public bathrooms, to help people stay out and about in a shopping district, to provide equity across different types of neighborhoods and locations, to allow parents with young children to stay at a park longer, to provide folks without reliable access to bathrooms, that dignity in a way that also makes other people happy by having the streets be less dirty, because people have to go to the bathroom, and if you don't give them an option, it's going to end up somewhere. And being willing to just acknowledge that fact and say, hey, there is a problem to solve here. And so, the need became more a better way to allow cities to provide public bathrooms that people actually want to use.
I love so much of what you just said. I mean, that so many insights packed into that. I don't know that I have a question here, but it's interesting to hear you say that this isn't medtech or and I know exactly what you mean. At the same time, this feels so very elemental health tech. It feels like it doesn't get much more core than what you are creating in terms of the most elemental of human need. And this feels so pure as health technology to me that it's interesting.
I love that you said that, because I'll say on a personal note, I have this deep I don't want to say shame. It's whatever word is right below shame about sort of receiving this amazing education from the kind of med tech community. And in my mind, sort of moving away from it, not because I didn't like it, but because a need brought me into a space that most don't consider to be med tech. But as you say it, I mean, I'll agree. I mean, I think it is urology, it is GI, but it is like, there needs to be a mechanism to allow people to go to the bathroom in a dignified way, and basically, creating dignity for, the only difference is maybe I wouldn't call them patients, right? This is, unless, in some situations that might be the case, but slightly more broad. But yeah, I think of it as, a basic human need that people deserve to have, and dignity is part of that. Yeah.
Yeah, 100%. This word dignity comes up often when you talk about Throne Labs, when just browsing through your website, and when people sort of learn about your company's philosophy. I'd love to hear a little bit more about what that looks like and what you are thinking of when you talk about a solution with dignity for a customer or for a user, I guess.
We do use that word a lot. And first, maybe it helps just to paint a quick picture of what our product is. I think just for people listening that don't know,
Please.
At very high level, we are trying to develop a network of publicly accessible, free, nice bathrooms that can really be placed anywhere. And so a piece of the technology is not having to be connected to infrastructure, i.e. water and waste, and in many cases power. So these are solar powered, self-contained, really nice bathrooms that trick the user into feeling that they're in an indoor bathroom facility. And then we're also, and I can come back to this, solving a lot of other problems having to do with providing a private experience in a public space, and sort of some of the security and safety and accountability pieces that come with doing that in an elegant way. And so we have some technology that also allows us to keep them clean and safe for everybody. Happy to go into more detail, but basically, if you were walking around a city and you see this big blue box, it might say free bathroom, scan to use. We do have a QR code entry system for most users. There are tap cards and other ways to get in if you don't have a phone. But basically, it's this big box that's solar powered, and you walk in and you just get this really nice touchless flushing bathroom experience in the middle of a park or downtown district, when you otherwise would likely either have nothing or maybe an old school brick and mortar bathroom. And so to now answer your actual question, now that I think maybe you kind of understand what we're providing to cities, across the country now, is a dignified private experience within a public space. And I think we at Throne recognize how private and vulnerable this experience is, and spend a lot of time thinking about how to both make people feel safe in a situation where maybe there's a line of people outside, or there's some technology, there's a door that's moving on its own, and things that are new. But once you get in, to just be like, this is almost like my home bathroom. It is the ideal endpoint. And because technology is involved, I think people often bring in ideas of, what is this company doing with my phone number? Who are they selling it to? So there's all this potential creepiness that we actively fight against. And one of our values at Throne is don't be creepy. And I think we are not selling your phone number for data. We're only using it to gather feedback on how clean the unit is and to create the sense of accountability so that the next user has the cleanest and safest experience possible. And there's a lot of trade-offs and difficult decisions here. But at the end of the day, what we care about most is people have a safe and clean bathroom experience and that they walk out happy and it solves a problem in their day. And I think in medtech, we always kind of talk about magnitude of impact for a need and also volume of impact, and sort of the multiplication of those two maybe are a way at looking at how big total impact a need can have. And I think this is one of those, you can actually have a pretty significant impact on someone's day, but you're not saving their life in most cases. But because of repeated use and the impact that you could have on that, let's say mom with two kids at a park where you saved their day in a significant way, but then multiplying that over, we're now well over 1 million uses, we sort of get that breadth of magnitude in that way.
So many follow-up thoughts about what you shared, but I want to jump on the very last thing you said when you said, well, we're not saving a life, but you actually have saved several lives as a direct outcome of decisions that you've made about the technology. I'd love if you could share a little bit more about that.
Yes. And so, I would say, the core use case of, allowing someone to go to the bathroom in public, tends to not save a life. But when you are dealing with high volume, and again, to bring it back to medtech, when we do our DFMEA analysis and whatnot, they're sort of like, well, at 10,000 uses or
for audience, could you just walk through what DFMEA is?
Well, I guess failure mode analysis and that kind of thing, and how you design the system in a way, thinking through how likely something might happen that could cause a risk or harm to a patient or a user, and then the magnitude of that thing and how much sort of quality control you should impart based on sort of, maybe to simplify, a multiplication of the severity and likelihood. And so, again, the same type of thing happens when you have millions of people using a machine that is out in public with a sliding door. And also you have the agency of human beings to kind of do what they will within these or around these units. Bad things are going to happen. Great things are going to happen. Surprising things are going to happen. But one example that we've come across, and I'll take a slight detour to mention, one of the big problems we heard from cities in trying to solve this problem is, hey, I've got these 5 different locations where we've tried to put public bathrooms for the last 20 years and they failed for reasons having to do with security, nefarious activity. The bathroom just kind of turned into a place where people were dealing drugs or prostitution. Again, you have a private space within a public space, and that can make cities nervous. And so we set out to really solve the problem without having, their old solution was to post up a security guard 24/7 outside bathrooms in a lot of these locations. That is a big part of our technology, to sort of try to create a sense of accountability and monitoring. We have remote monitoring on the units, not a camera inside the unit, but there's a lot we can do in terms of, we do have security outside in many cases, but a lot of the firmware and terms and conditions and accountability measures that we provide in the bathrooms solve for these problems. But to get to the actual point, we're in a couple locations that are very difficult historically, but we've been able to solve. But that an example would be Westlake MacArthur Park in Los Angeles and various other locations, and where drug use, unfortunately, is fairly rampant. And one thing that will happen is people will use drugs in a bathroom. One of the decisions we've had to make is how do you create safety around that? Do you try to totally prevent drug use? So there are some strategies of using blue light to make it really hard to use intravenous needles optically. Did a lot of research on that and found that the problem is people tend to try anyway, and it's almost more dangerous if you can't see. And so you can imagine there's all these tricky trade-offs trying to control for these edge cases, I guess. But what the other issue we have is, in some of these locations, people tend to not want to leave after a certain amount of time, campouts as they're called. And so we decided to kind of control the door. And the sliding door is sort of our bouncer to some extent. It also allows us to connect each use to some form of account. We don't care about your name. We don't care about your occupation. We do use a phone number or a card in most cases, which allows us to ask you how clean the unit is. But if we are noticing that you're someone who is refusing to leave after a certain amount of time or repeatedly causing very large disturbances to the cleanliness or safety of the unit, we can warn or block you. But honestly, one of the simplest measures is just have a time limit and have the customer actually get to set the length of time that a unit allows for a use. We have audio, lights that blink, signage for people that can't hear or can't see, that warn you, kind of like the Oscar play out, that the use is approaching an end, and we give ample warning. But in a lot of cases, we have a 10-minute use limit, and then the door will open usually after actually about 11 and a half minutes with extra extensions. And this is something that a lot of people hate and push back on. I think you'd also hate it if you show up to a bathroom and someone's in there for 45 minutes in a public space. So there are definitely normal everyday trade-offs, but the trade-off that has come about and clearly solidified the decision to have this time limit has been on multiple occasions, the doors opened and someone has passed out on the ground, seemingly from an overdose. And in a couple cases, and one in particular, one of our cleaners earned one of Throne's internal Golden Plunger Awards when he found a person passed out on the ground, called 911. 911 trained him over the phone to provide CPR for about 7 minutes till paramedics came. This was like a young person who was totally saved. And, our cleaner, wearing a Throne shirt, totally into our mission, didn't even think twice to kind of do this and took a lot of pride in it. And it's a big part of how we train staff. It's not just about cleaning the bathroom or keeping the bathroom nice. It's about talking to people and providing this service to everyone. And that just, that doesn't happen very often, and certainly something we don't intend to happen, but you also have to be prepared for, and training and processes around that.
Wow. What a story. Fletcher, I'd love to ask you some nuts and bolts questions about building Throne, but something that has been jumping out to me from the beginning, and really since as long as I've known you and gotten to meet you over the years, is you have this real kindness about you, and it is something that comes through the Throne culture. And when I hear you talk about your team, it's something that I hear from the team, this kind of commitment, this real value that everybody places in the shared cause. And that doesn't happen by chance. And I'm curious how you think about building a team and how you shape those values and how you kind of continue to build the culture once you have that team together.
I think any entrepreneur listening or anyone thinking of starting a company, like, this is the part to listen to, right? The whole thing is what team you're able to pull together. And I'm still learning. I get duped in interviews all the time. It is very hard. People are great interviewers, but you're right. Like, what you're trying to get at is what are the things you can't train someone on? And a lot of those are like inherent personality traits. Curiosity and kindness are definitely up there. And so, someone who knows it all and maybe lacks any amount of humbleness, no matter what their background, tends to not get a second interview at our company. And so, definitely have to pass the sort of kindness and curiosity filter. But again, that is hard. People are good actors and actresses. I think the other two things we've found at Throne that are really valuable. We have another value called I Heart Toilets. And the idea here, this is the sign off that my co-founder Jess put on an email after we had first met, and kind of has lived on as a value. But I think what we found is there's a percentage of people that just think what we're doing is kind of weird, and why did you leave the Bay Area and Medtech to pursue this porta potty company or something like that. And I think, but there's another half of people who just like totally get it. And I can't tell you how often someone says like, I actually had this idea, or I tried to start this company. I love, by the way, I love when I hear that, because it is sort of an obvious thing to try to do, right? But or they sort of have the Larry David side of them, where they're just obsessed with different types of toilets and bathrooms and whatnot, which more my style. And then others that just really dig the mission and sort of the public good piece and the civic provisions piece of it. All of those sort of count as I Heart Toilets. But I think when there are people that come in and want us to be Uber, or want us to be something else that we just kind of aren't, we sniff that out. And if you're listening and ever applying for a Future Throne job, we are scoring you on I Heart Toilets, and that is one that I think is hard to fake. And the last one is this, and this applies to everybody, is just, I want to work with this person. When interviews turn into brainstorms, and discussions rather than, reading scripts or something, that goes a long way too. And so it's about doing all that. It's about one other thing too that is just hard. And something I didn't do as much at the first company, which is calling it when it's not a fit, and making changes to the team. But whether that's, you were a great fit for the last phase and maybe not a great fit for the next phase, and just making sure that the team that you have is like perfect for the next phase, and being honest that there are people that are great for certain phases and not for others. And, the goal is to have the team that's great for now. And so that's where this sort of like Michael Scott, we're all a family, doesn't quite work if you're really trying to be a really strong company, but at the same time, really valuing and respecting the folks that you have on, and valuing those that you have to move on from, and being kind in the way that you kind of make those changes, whether it's severance or just sort of the communications around it. But those are tricky things that by far the most important piece of the whole thing.
You mentioned phases and your different chapters, different eras of where you are at a given point. I think it makes sense to someone who is on the outside, who hasn't built a company before, that you can be a company and you can be getting new customers and you can be sort of up and running and sort of having to adjust things and sort of change your trajectory, and all of those company things make sense. I think what is harder for, and maybe more intimidating for someone to understand, is how you go from these insights that sounds like you bump into people who claim to have had the same exact insight. What did that look like, going from that insight to, I guess, first order from a customer?
Yeah, it's a really good question. So I think the key skill here, and what I would say is how I would define each phase is, what is the biggest risk the company has to put down for that phase? Is it, and this totally applies to medtech, right? Early on, there's often like a technical risk phase. We need to be able to do this thing. Then there's maybe a clinical risk phase where we need to show that doing this thing doesn't lead to this safety adverse event, or does provide this efficacy. Same thing here. I think, and actually a quick aside, I think the most common pitfall I see from early founders is building the thing, no matter what, even if there's no technical risk there, and not jumping straight to the clinical risk mitigation, if that is possible, or jumping straight to the thing that is keeping you from getting the next $15 million or customer or whatever, and really being really clear, what is the current risk that we're trying to take down. So early on, the first one was, who's going to pay for this? And I kind of went through that, and that's all that mattered. We were building prototypes and testing things to kind of understand how the product would be designed in parallel, because we kind of knew where we were going, but the right experiments couldn't happen until we understood who was going to pay for this and what problems we need to solve for that customer. And so I'd say the first phase was, who's going to pay for this? And then when we settled on municipal, and the way we settled on them was when we did get the first 3 contracts from small cities around the DC area, Fairfax, Virginia, and Hyattsville, Maryland, who are still customers and have been great partners. They're willing to pay for it. Now the next phase is, how can we keep this company funded and stay alive with the central expense structure that is needed to to run an organization like this. And so that I can get into that, but I think really defining what the key risk of each phase would be, and so that then can influence what product spend or kind of innovation you need to do. Because let's say you might find that, okay, it's not as simple as, cities will pay for this. It's cities will pay for this if you can solve this security issue. You can solve the infrastructure and planning problem issue. You can solve the timeline issue, i.e. you can put bathrooms down soon enough so that the current elected official gets credit for it, as opposed to 3 years down the road when an infrastructure install happens and the next mayor is going to get credit. So there's all these mini problems that then inform the product side. And that's when you de-risk product, is when you already know, if I build this, they will come. And so hopefully that kind of answers some of that question. But yeah, it's really being clear about what is the risk we're trying to take down, what is the money we need to do that, and what is going to, and what is the milestone we need to hit to be able to get to that next phase.
So did these early conversations begin without so much as a prototype in the physical world?
Yes.
Wow.
Yeah, I think there was an early phase where we spent a lot of time. I partnered with some folks from the traditional portable sanitation world who had bought like a 50-year-old porta potty company, and really spent a lot of time, pretty much knowing we weren't going to go into that space, but hey, there's a lot of operational insights that industry does a lot of things really well, and kind of learning from that, and how their customers think. But I think we were able to raise some money and kind of do a lot of that customer engagement and feedback, and get to the point where municipalities were involved. I would say it's a little hazy. Things happen in parallel and not quite as clear cut as I just mentioned. But we did have a phase where. This is also the scrappy prototyping part, where we would just buy let's call it a high-end porta potty and soup it up with a lot of technology. We had I was in Virginia for a while, and we had this porta potty that had you could text a number, and it would a creaky door would open with an arm, and people were like, oh, that's really cool. And really just an experiment to see, do people treat a bathroom better if there's some form of accountability attached? So that was sort of, as we started realizing accountability and, if we can decrease the average cleanliness detriment per use via nothing but accountability, that will be a huge factor in solving the problem for the customer, which is every time we provide public bathrooms, they just turn into disgusting messes. So it's all intertwined, and it's less in series, as I said before, where you kind of get a little bit of an insight. So then you kind of develop a little bit of product to answer the next question and get back. So I don't want to pretend it's so simple in real time, but hopefully that answers some of that.
It does. It's so interesting how much is going on below the surface. I'd love for you to brag for a couple of minutes about some of the really neat technology. I think there seems to be a whole lot more than meets the eye with Throne, and I'd love for you to share what's going on behind the scenes to enable this very comfortable luxury almost experience for your users.
Yes, this is the part I love, and there is a lot going on. It's not as easy as you might think to provide nice public bathrooms in public spaces and solve for all these other problems. So I would split sort of the product innovations into various buckets. One is sort of the hardware piece, providing this big physical structure that doesn't require, the original product spec here, which has changed a little, but was a hotel lobby bathroom that can be placed in a Home Depot parking lot in an hour or less. And so, it just needs to be an indoor bathroom that's outside. We don't need to reinvent the indoor bathroom. We would later do that in some ways too. But in general, flushing bathroom, flushing toilet, running water sink, reasonable temperate and temperature control and ventilation, but not connected to waste and water. That's a 2-year, $1 million project, and ideally not connected to power, which is not as big of an issue, but nice if you can solar power it. So we have solar panels, batteries, this kind of security door, which I kind of talked about a little bit, and then a lot of technology behind the scenes to manage waste and use water really efficiently. So we have large holding tanks within the walls of this thing. We do have a pump truck organization that needs to come around and add fresh water and pump waste out. We run that operation ourselves. But there's a vacuum assisted maceration system in there to grind up the stuff and efficiently move it around so that we can use way less water. There's sensors in all these tanks to let us know exactly when water is needed, and that actually feeds into a back end into our operation, as I'll get into. And there's a ventilation system that has a lot of active firmware running to kind of be extremely power efficient, so they can run off solar even through the winter. We have winterization systems to keep just the most critical components warm enough in the winter off solar. There's all this stuff that is there, not to mention all the DFM, design for manufacturability, to be able to. So we control the design. We do partner with a manufacturer, and we do a lot of the manufacturing ourselves. We ship logistics we run the logistics to ship these units to our 4 metropolitan areas, about to go to 7. And then we run all the operations ourselves. So that leads into the next part, which is the technology in the back end to allow us to operate and service these units extremely efficiently. And so a theme you'll notice is we've just kind of decided to control pretty much the whole stack, aside from the first 4/5 of the manufacturing of the throne itself. So we do partner with a group, Satellite Industries, the largest manufacturer in traditional portable sanitation in Indiana, but we own the design. We tell them what to build, and much like a contract manufacturer. But then down, we have a team. We have a manager, we have a tech lead, we have techs, we have cleaners, and we have pumpers. And so we have this distributed service team, and a lot of, when I said before, spent time with some folks, our 2 of our co-founders from the traditional portable sanitation industry. We learned kind of what the traditional that's porta potty companies, what they're doing in terms of how to decide where to send trucks and whatnot. And what they're doing is basically sending someone on a schedule to different units to both pump and clean and fix, or all 3 of those things. We see those as 3 totally different jobs that require totally different skill sets and different visit frequencies. And so what we did was vastly increase the holding capacity of this over a porta potty so that we can pump less frequently, and then create a separate cleaning workforce that allows us to clean extremely frequently. So on average, we about every 10 to 12 uses, and a lot of these units are getting over 100 uses a day. So you can imagine we have a roaming cleaning workforce that is responding in real time to inputs from users and other sensor data, things like how many uses, how long were those uses. We're working on cool things like smell detection and whatnot. But so the other cool thing we have is this back-end system that uses historical data and real-time data to basically decide which Throne employee should go touch which unit at which time, with the idea that we want to, when an issue happens, touch that unit as quickly as possible, but don't just schedule things, only go when it's needed. So there are sometimes, we have units in Ann Arbor, Michigan, and I love that community. There's something about that community where 45 people can use a unit, and you walk in and it seems totally clean. The average cleanliness detriment per person there is by far our smallest. And I don't know.
Wow.
Some social scientists should come around and kind of study what's going on there. But so we don't have to clean as frequently there, or at least in some locations. And so using real-time data to decide when we should clean is a big part. And then having the workforce and so we have a lot of really cool tech that is making that calculation in the background, an internal staff app that is basically telling people where to go at what time, calculating clean risk. What is the % chance that throne needs to be cleaned? There's a lot of cool, close the loop. How do we then iterate that algorithm over time? So a lot going on, and that's just on the cleaning side. Same goes for pumping and tech maintenance and visits and whatnot.
Wow. So fascinating what's happening kind of beneath the surface.
Yeah.
I would love to know with all of these different features and pieces of the machine that you have built, the process machine and the actual machines, what learnings or surprises have led to changes? Or I'd love maybe if there's one thing that comes to mind.
I think the skill of observation has been huge here. And one of the advantages of Throne compared to Medtech that I love is one of the downsides of Medtech in a lot of cases is you spend 6 months developing something, and then it takes 2 years to kind of get a couple data points on whether that thing worked or not. That's what makes that space really hard, and why I have so much respect for the people that do it. I think one thing that has been refreshing about Throne is we can make a change and like in 4 days have hundreds of data points on it, but also being able to go sit near at a cafe near a Throne and just kind of watch how people use it from the outside. But certainly, user interviews post use is a big a big thing we've done early on. We need an app. The only way to get into a Throne was to download an app. And one thing we noticed was people hate that. When you have to pee and you're in a busy location where the signal is weak and you're waiting 5 minutes, I mean, this like existential, like, what is this world coming to? I hate this. And so like really quickly, we're like, we need to find a really quick way to get people in while still maintaining the criteria that we're connecting your use to some sort of your identity, which ended up being in most cases phone number. And we had this quick scan to text solution that gets you in 5 seconds. But I think that kind of thing, talking to users, and honestly, that extends to like a deep philosophy of ours, which is like listen to our users. So we ask, how clean is the Throne when they walk in? More recently, we've created different questions that like 1/5 of the time you might get a question of how does the Throne smell, and sort of other questions that can kind of feed into maybe Airbnb style, like get different data points from different users and piece together a story of what we need to focus on from an R&D process or ops point of view.
Last question. What does the world look like in your eyes if everything goes the way you would love it to go for Throne? Expand as much as you like, get full saturation everywhere you might be located. What's the vision?
I think the thing that we're doing that really no company has done before is just go all in and be willing to bring technology into this all in on sort of fully understanding every facet of bathroom infrastructure problems and bathroom infrastructure very broadly. Think any bathroom and just being the masters at drastically improving the access to, reliability of, and cleanliness of bathrooms anywhere. And so I see sort of this solar-powered modular bathroom as the initial product. I think there's a lot we can do to improve existing infrastructure, to improve the efficiency and utilization of existing infrastructure, whether that's public bathrooms, retail bathrooms, home and office bathrooms, whatever. And so the future vision is really to be associated with a pleasant bathroom experience. And so if you see a Throne logo at a business or as you're walking around, it's just like, we've removed that anxiety of, the bathroom isn't going to be the thing I need to worry about here. And I think that's our zone. I mean, there are a lot of other problems to solve in this world. I think we're putting everything towards just being that anxiety reducing bathroom company.
That's fantastic. You can't get much closer to the human experience than what you're describing. Fletcher, thank you so much for talking with me today. Where can people go to learn more about you and more about Throne?
I would say our website, thronelabs.co, is a great place, or kind of DM me on LinkedIn. That's where I kind of, that's my most used social interface. And for all those listening from Biodesign, I definitely hope to get out to the Bay Area soon and talk to all of you. But if you're listening in general, always open to if budding entrepreneurs have questions and maybe especially on the topic of switching networks. That was a really hard thing to do, to go from having this really deep network and then going into, I don't know, more like tech. Happy to talk through those types of things with folks if you reach out.
Well, Fletcher, thank you so much.
Thank you, David. That was very fun. Thanks.